And Tori also asks, are there conditions that can be eliminated by utilizing chiropractic as preventative care? Well, of course, the problem with prevention is you never know what you prevented because it never happened. But for instance, people who come in and say, they come in, maybe they have back pain, and they'll say, my father had back pain, my mother had back pain, they had to go to chiropractors, or they had to take medications all the time. I think that's going to happen to me. Can you prevent that from happening to me, or something like that? Or they're trying to do a lot of exercises and things. Sometimes people hurt themselves doing exercises to help themselves. So preventing that, yeah, because a lot of things that happen to people aren't, even if there's genes involved, the genes don't necessarily have to express themselves. And sometimes with these things that happen in families that are passed down, supposedly, they're actually bad habits that are passed down as opposed to real genetic potentials or predilections to having problems like that. So chiropractic, by adjusting the spine, by keeping the spine as normal as possible. And yes, I also adjust knees and elbows and ankles, but that's usually because there's a problem there, there's pain. But to keep the spine functioning normally is a good thing. I mean, the yogis would say that you're as young as your spine is flexible. So keeping your spine flexible is very important. And I've seen it a lot in my practice. You see the difference when people get up in their 60s and 70s and beyond. You can tell the difference just by looking at how a person moves, whether they look older or they feel older, or maybe younger than the years, or sometimes older than the years, depending on how their spine moves, how their body functions. So in that regard, chiropractic is essential. Everybody should have a chiropractor, the way people need dentists and primary doctors, because it's important to keep the spine as functional as possible, both with the chiropractic adjustments and as well as with a good exercise regime that helps to strengthen and stretch your back and your neck on a daily basis. I have patients who've been coming to me for years for what they call maintenance care. And maintenance care, generally the people come in maybe once a month, depending on the problem. Some people probably should be here more than once a week because they have these permanent problems. But I'm not going to have people coming that often. I don't want people to become dependent on chiropractic care. But on the other hand, when you have areas that are like this is normal motion, but if you have areas that are like this, then your spine's not going to move properly, and it's not going to function properly, and you're not going to feel as good as you could feel. So chiropractic is a part of a good, healthy lifestyle.